Liposuction is one of the most common surgeries that I perform. With the right techniques in the operating room and the right post-operative pain management plan, liposuction can be very tolerable and very comfortable. I use a specific medication in the operating room prior to performing the liposuction that helps treat pain while I'm performing the surgery. And then I always send pain medications to the patient to take after surgery, because the first couple days they'll be sore, but it's nothing, out of the ordinary. I always make sure that they're comfortable. I check in with them. If their pain is worse than expected, I could always send other medications or kind of alter my plan. But that's why it's really important to go to somebody who does these procedures regularly and has the right plan before surgery, during, and afterwards. Some patients, they're afraid prior to surgery, or they have a little anxiety prior to surgery, and that's completely normal. I like to see these patients sometimes multiple times prior to surgery, because I like to reassure them of what to expect afterwards. And oftentimes I'll have patients tell me it's not as bad as I thought it would be. And that's because during surgery we use specific medications, specific techniques while we perform the surgery to help patients recover in a much kind of more comfortable way immediately afterwards. So oftentimes patients will tell me it actually wasn't that bad, and your description of the surgery and what I should expect after was kind of right on the money. Sometimes I'll get patients, for example, it'll be a female who's very active, leads a very healthy lifestyle, exercises, eats very healthy, but sometimes will point out that her love handles or her abdominal region just has stubborn fat that she can't get rid of, no matter how much cardio she does, how many times she goes to the gym, or how many sit-ups she does. And in that patient who's leading a healthy lifestyle, who has realistic expectations, liposuction can really give them really dramatic results, really treat those areas that they're not able to kind of take care of on their own. So the definition of lipectomy is really just the removal of fatty tissue, and we can accomplish this in different methods. So one of the ways we can remove fatty tissue is surgically to remove it. This is commonly done in body contouring surgery in patients after weight loss or massive weight loss, and one of the methods is a belt lipectomy, which means removal of fatty tissue around the abdomen and all the way around the back in a circumferential fashion. The other method for removal of fatty tissue is commonly known as suction-assisted lipectomy, which is, most people know it as liposuction. And what we do there is, using a cannula through very small, tiny incisions, we specifically target certain layers of fatty tissue underneath the skin to contour the body. And really the best way to go about figuring out which procedure is best for you is have a consult with a plastic surgeon who's going to describe the different procedures, evaluate your skin, evaluate your body, and give you his or her best recommendation. So a surgical belt lipectomy versus liposuction, those are two completely different procedures with different recoveries. A belt lipectomy requires an incision and the surgical removal of skin as well as fatty tissue circumferentially, which requires then suturing the wound back together. That'll lead to a little bit of a prolonged recovery compared to liposuction, because in liposuction we're making a couple very small 1 to 2 centimeter incisions and using a cannula to suction out the fatty tissue. So there's really not a prolonged recovery with liposuction because there's not huge wounds to deal with.